Hi everyone. Today in this video let us discuss side effects of Losartan. What is this drug Losartan? The suffix sartan indicates that this drug is angiotensin-II receptor blocker, commonly known as ARB. We have so many drugs ending with the same suffix sartan, and these drugs are classified as ARBs, angiotensin-II receptor blockers. This Losartan can be given in the form of potassium and it is available under the brand name Cozaar. Just like the other ARBs, Losartan can be used in the treatment of hypertension, both in the adults as well as in the children. But within the children, age greater than 6 years, this drug can be used to control hypertension. Since this drug reduces the blood pressure as well as it inhibits renin-angiotensin system, this drug can reduce the risk of stroke in the patients with left ventricular hypertrophy. Apart from these two indications, Losartan potassium can also be used in the treatment of diabetic nephropathy in the patients with type 2 diabetes mellitus. In such patients, Losartan potassium can be used to reduce the raised serum creatinine levels as well as to reduce the proteinuria, excretion of protein within the urine in these patients. So today in this video, let us see what are the important side effects of Losartan potassium. The first important side effect is the dizziness. Losartan can produce some lightheadedness in the patients, which may impair the daytime activities, and this drug can also produce few of the central side effects such as headache because of cranial vasodilatation. It can also produce somnolence, sleepiness in the patients. And in few of the patients, we can also observe some vestibular disorders such as vertigo, reeling sensation as well as tinnitus, some noise in the ears. So these side effects are commonly observed with use of Losartan. Second one is the hypotension. Since Losartan acts as an antihypertensive, it can reduce the blood pressure, but the hypotension as the side effect is not commonly observed. Few of the conditions may increase hypotensive effects of Losartan. For instance, use of diuretics may increase the hypotensive effect. Thiazide diuretics like hydrochlorothiazide, thiazide-like diuretics like chlorothalidone, these drugs can be combined with other antihypertensive agents in order to reduce the blood pressure and to reduce the cardiovascular complications. These drugs mainly act by increasing the renal excretion so that the body volume is going to be reduced, thereby cardiac workload is going to be reduced. So diuretics mainly increase the excretion of water, resulting in the volume depletion, and it can also increase the excretion of sodium, resulting in salt depletion. So in those patients with volume depleted and salt depleted, these diuretics may produce some hypotensive effect. High ceiling diuretics like furosemide can also be used in few of the cardiovascular complications. If these diuretics are combined with Losartan, then they can produce a significant hypotensive effect. So when Losartan is combined with any of the diuretics, hypotensive effect can be observed, which may result in orthostatic hypotension. So care should be taken when driving the vehicles or working with machinery because of any sudden drop in the blood pressure that can be observed with Losartan when it is combined with diuretics. Third one is the upper respiratory infections. Use of Losartan may induce cold-like symptoms resulting in nasal congestion, sinusitis, and pharyngitis can be produced by this drug. Fourth one, muscle cramps. Losartan can also produce some back pain as one of the important side effects that can be observed in most of the patients, and it can also produce some joint pain resulting in arthralgia. These are again commonly observed side effects with Losartan. Fifth one is the cough. AC inhibitors are one category of drugs which are again acting on the renin-angiotensin system. We can identify these drugs with simple suffix pril. These drugs can be used in the management of hypertension. We have so many drugs like lisinopril, enalapril, ramipril, fosinopril. All these drugs are the AC inhibitors and they are used in the management of hypertension. These drugs are going to inhibit the renin-angiotensin system, but when they are used for long term, they can produce dry cough in the patients. So ARBs can be used as alternatives for AC inhibitors Therefore, Losartan can act as an alternative for ACE inhibitors. But if the patient is already prescribed ACE inhibitors and then they are shifted to Losartan, then this drug can also induce the dry cough in such patients. So in those patients with previous history of use of ACE inhibitors, again chance of dry cough may be increased with use of Losartan. Even it produces some less significant dry cough compared with ACE inhibitors, but still there is a chance to develop dry cough in those patients who have already taken ACE inhibitors. Sixth one is the hyperkalemia. This is one of the important effects of the Losartan. Losartan potassium may increase the potassium levels within the serum, resulting in hyperkalemia. This hyperkalemia is more pronounced by many of the factors and other drugs. So normally serum potassium levels may be variable. Based on that, hyperkalemia is categorized into different grades. In the mild hyperkalemia, serum potassium levels are variable from 5.5 to 6.0 millimoles per liter. In the moderate hyperkalemia, the serum potassium levels are variable from 6 to 6.9 millimoles per liter. And in the severe hyperkalemia, serum potassium levels are greater than 7 millimoles per liter. Now, Losartan can produce a mild to moderate hyperkalemia in few of the patients with any risk factors. The induction of hyperkalemia can easily observed with few of the symptoms in the patients. So, Losartan may induce confusion, muscle cramps, altered mental state, and any difficulty in breathing can be observed. If any of these symptoms are found in the patient, then potassium level should be thoroughly checked in order to avoid further development of hyperkalemia. The induction of hyperkalemia by Losartan is more pronounced with existence of few of the factors. For instance, the risk of hyperkalemia increases with progression of ACE and the presence of diabetes in the patient, or in those patients with any renal failure, heart failure. In such conditions, hyperkalemia is more pronounced with use of Losartan. Apart from these conditions, few of the drugs can also influence the hyperkalemia. So any medications such as renin inhibitors, for instance, L-aspirin is one of the renin inhibitor which again inhibits renin-angiotensin system. So if this drug is combined with Losartan, it can produce severe hyperkalemia, so it should not be combined with Losartan. Similarly, few of the drugs like beta blockers such as propranolol, they can also increase the potassium levels resulting in hyperkalemia. And immunosuppressants which are used for organ transplantation such as cyclosporine, tacrolimus. So all these drugs can increase the risk of hyperkalemia with Losartan. So when they are combined with this Losartan, care should be taken to check any development of hyperkalemia, and the serum potassium level should be thoroughly checked in order to prevent fatal effects of hyperkalemia. Similarly, few of the other drugs such as potassium sparing diuretics like amloride, tramtarine, spironolactone, and cardiotonics like digoxin, potassium supplements, when they are combined with Losartan, they can increase the risk of hyperkalemia. Not only these drugs, sometimes the diet can also influence the risk of hyperkalemia when they are combined with Losartan. So intake of potassium-rich foods such as turnip, potatoes, dried peas, avocado, high intake of bananas, and various types of nuts which are rich in potassium, all these food can increase the risk of hyperkalemia when they are combined with Losartan. So care should be taken to avoid potassium-rich foods, and potassium supplements are those drugs which are increase the potassium levels in the serum along with Losartan. Seventh one is the impaired renal function. Even the Losartan can be used for the treatment of diabetic nephropathy, but this drug may produce some renal impairment resulting in oliguria, the decreased urinary volume, as well as azotemia resulting in the increased nitrogen content within the blood due to the decreased excretion of nitrogenic substances. So these conditions may further impair the renal functionality. Finally, it leads to acute renal failure. And even ARBs can also produce renal artery stenosis, the narrowing of blood vessels supplying to the renal system, which may further reduce the renal functionality. So in those patients with any pre-existing impairment in the renal function, Losartan should be carefully given. Eighth one is the fetal toxicity. All the ARBs are teratogenic including Losartan, when this Losartan is given to the pregnant woman, it can produce some teratogenic effects leading to fetal toxicity. That's why this drug is strictly contraindicated in the pregnant woman. And even to the breastfeeding woman, this drug should be carefully given until unless the benefit is observed. But generally, Losartan is not preferred again in the breastfeeding woman in order to avoid any effects in the infants, particularly on the renal system. So these are the various side effects produced by Losartan. It mainly produces the dizziness as important side effect, which results in lightheadedness and sleepiness in the patients. It can also produce some vestibular disorders resulting in vertigo and tinnitus. Muscle cramps can be produced resulting in muscle pain and joint pain. Back pain is another important side effect produced by Losartan. And this drug can produce hypotension when it is combined with diuretics, which produce volume depletion as well as salt depletion. Losartan can increase the cough produced in those patients who are already taken ACE inhibitors. And this drug may increase the serum potassium levels resulting in hyperkalemia, which is more pronounced with other factors like existence of diabetes, kidney failure, heart failure, or by use of the drugs which increase the serum potassium levels such as renal inhibitors, beta blockers, immunosuppressants, and even potassium sparing diuretics and potassium supplements. All these can increase the hyperkalemia.